Detroit has definitely made the national spotlight during this pandemic, um, because of the high number of people that are contracting the virus, but also passing from it. And I think for everybody, it's a little more scary when originally thought you had to be 60 years or older to get the virus, or in poor health. But we're seeing young people in their 30s and 40s getting the virus, and even a lot of my friends that are in their late 20s. Um, Many of them are just having mild symptoms and getting through it. But for the most part, I mean, in 1 week, I had 7 people that I knew personally pass away from it, and it starts to hit home. Originally, back in February, early March, when you hear about it in China, and then you hear about it in Washington State, and then it kind of spreads through the country, and now it's here in your own backyard, and people personally passing from it. It gets a little scary at that point.
What's your day-to-day kind of consist of?
So I work in the mayor's office here in the city of Detroit, and for me personally, I'd have to get out there and be on the front lines and do whatever I could to make sure that people were getting tested when our testing site opened up. So I've pretty much been out every single day at our state fairgrounds, where we're running probably the best and most efficient testing site in the nation, testing up to 1,000 people a day for the past 2 weeks. And so I've been out there every single day, whether it's controlling traffic, signing people in, making sure they get through efficiently so that they can get in and out. I mean, it's already scary enough thinking that you may have this virus, but to be able to get through a testing site pretty quickly and then get the results in about 4-day turnaround is pretty good for our residents. Everybody's told to stay to themselves. Our community has really come together, staying on track with social media and seeing how people are tapping into resources. And there's a lot of people behind the scenes working to help small businesses, helping to provide food to people that can't get out, food to our frontline workers. I mean, our city, and I may be a little biased saying this because I work for the mayor, but I think we've done a really, really good job at coming together and helping those in need at a time when, no one's ever seen anything like this before. And, you can't really wait for somebody to come, the federal government to come. I think locally you just have to do with what you know best and come together and put the resources together and help address some of the needs that are out there.
The local government, the state government, and the federal government, how do you feel that response has been overall?
Yeah, a lot of this has to be led and directed by the federal government. I mean, they have the purse strings for a lot of what the state governments need, and then obviously it comes down to the local governments. And early on, I don't think our federal government was really paying much attention to the science behind what was going on. And you see people like Dr. Fauci on TV, who makes a whole lot of sense to me, finally being able to get out there and being in the front and letting people know what's really going on, so that there's not, because if you don't pay attention to science and brush it off as it's not affecting as many people as we thought, and then you see all the numbers come out, it scares people. Yeah. And so I'm glad to see Dr. Fauci taking more of the reins at the federal level. Our state government, Gretchen Whitmer, who's our governor, has been phenomenal, getting out ahead of this as much as she can, putting in the executive order. I think we were the 5th state in the nation to do that, stay-at-home order. I think if that didn't happen early on, there would have been a lot more deaths, a lot more people affected by this. And then you look at, I'm going to be biased. Our mayor used to run a hospital system and a healthcare system, Detroit Medical Center, and so he's not new to this, and he's been doing a hell of a job at getting resources, pulling people together, helping businesses as much as we can. So, it's been a whole team effort, not just city government, state government, but also some of the nonprofits in the neighborhood, some of the business groups in the city. Everybody's coming together. So I've been pretty impressed, and I'm proud of our city.
What do you think the long-term effects, or do you think there'll be lessons learned during this period?
I was just talking to our chief public health officer about this, and I think if anything that comes out of this, a huge campaign at prevention and just getting people healthy. I mean, whenever a pandemic hits like this, people who aren't in the best of shape and have pre-existing conditions are the ones that are affected the most. And I think,
Yeah.
we have to do a really good job at making sure people get active, get healthy, have access to quality foods and, medical care.
It could be a really dark time for a lot of people, but what's keeping you centered?
Just knowing that, your brothers and sisters are out here listening to what's going on and making sure that they're doing their part to stay indoors and let the frontline workers do their thing. I think that's all we can do at this point and make sure that we flatten this curve by doing our part.